CJ is a doctoral student at the New School of Social Research in New York. He's a member of the Trauma and Affective Psychophysiology Lab under the mentorship of Dr. Wendy D'Andrea. The research focuses on elaborating the psychological, behavioral, and physiological mechanisms of the therapeutic action of psychedelics when used in naturalistic, ceremonial, or clinical settings, particularly with respect to their potential utility in the treatment of developmental trauma. They draw on the theoretical frameworks of contemporary psychoanalysis and interpersonal neurobiology for an integrative understanding of symptom reduction and character change associated with psychedelic experiences. CJ's presentation is titled "Using Psychedelics with Therapeutic Intent is Associated with Lower Shame and Complex Trauma Symptoms Among People with Histories of Child Maltreatment." So again, welcome CJ, and we are very excited for your talk. The stage is yours.
Thank you so much. I'm really excited to be here with you all. And yeah, the title of the presentation was just read, so I'll go ahead and jump in. I want to begin by acknowledging that I'm giving this presentation from occupied Muncie land, a place now called Staten Island. And I also want to acknowledge my co-authors on this study, my colleague, Kelly Ann Lee, and my mentor, Wendy D'Andrea. So to give a quick roadmap of the presentation, I'll begin by covering some of the theoretical background of the study, then briefly review the methodology. Then I'll present the main findings and discuss some of the implications of those findings. So to go into the theoretical background that went into the development of this study, I'm drawing on contemporary post-classical psychoanalytic theory in beginning with the idea that we become who we are in and through our relationships with important caregivers as children, beginning from our first moments of contact as infants. Which is to say, the self is inherently relational, and becoming a self is a developmental and inherently relational process. And in this developmental matrix between child and caregiver, this relational matrix, we develop not only an internal model of who we are, but also of who others are. And these internal models of self and other, these cognitive, affective, behavioral, procedural, representational schemas of self and other organize our self-concept, our social cognition, affect regulation, and relational behavior throughout the lifespan and are highly resistant to change. When children experience chronic maltreatment, also called complex trauma, or I'm fond of the term developmental trauma, and this includes physical abuse or neglect, sexual abuse, emotional abuse or neglect. When children experience developmental trauma, these experiences fundamentally shape or imprint the child's internal models of self and other, causing a negative or unstable sense of self, pervasive affect dysregulation, and interpersonal dysfunction. So how does this relate to psychedelics? We know empirically, just like Dr. Vollenweider just discussed a few minutes ago, that psychedelics acutely modulate the experience of both self and other, and often lead to lasting changes in personality and self-concept, as well as social cognition. Theoretically, it's been proposed that psychedelics relax cognitive predictive models and representations, temporarily dramatically increasing their plasticity and pliability, and creating a window of time in which they're especially sensitive to new learning that allows for their transformation and revision. So I'm suggesting that psychedelics might relax or loosen or fully disintegrate internal models of self and other, and that when people have models of self and other that were maladaptively imprinted by relational experiences of developmental trauma, taking psychedelics might allow for those maladaptive models to be adaptively updated, to be re-imprinted, which will fundamentally transform both the self and how we experience others. So my research questions in this study were, first, how does developmental trauma affect schemas of self and other in adulthood? And second, how does using psychedelics with therapeutic intent affect those schemas? I operationalized negative self-schemas in a measure of internalized shame. Shame is a relational affect, and so internalized shame gets at the internal relational element of negative self-concept, as well as a measure of complex PTSD symptoms that comprises negative self-concept, affect dysregulation, and disturbances in relationships that altogether are collectively conceived of as disturbances in self-organization. And I operationalized schemas of others in a task that assesses facial emotion recognition. Prior studies have found that both developmental trauma and psychedelics affect facial emotion recognition, but the nature and general pattern of those effects remains unclear. My hypotheses were first to replicate prior findings about what we know about child maltreatment. First, that developmental trauma would correlate with internalized shame and PTSD symptoms, and negatively correlate with facial emotion recognition accuracy. And second, that intentional therapeutic psychedelic use would be associated with lower shame and lower PTSD symptoms and better facial emotion recognition. To just very briefly discuss the methodology of the study, I recruited primarily from Reddit, and I assessed whether people had ever used psychedelics with therapeutic intent with the following question that you can see here. Have you ever used a psychedelic or entheogenic or hallucinogenic substance, including but not limited to psilocybin magic mushrooms or truffles, LSD or acid, ayahuasca or yahe, mescaline or peyote or San Pedro, DMT, MDMA or ecstasy, ketamine or 2CB, with the intention of healing or processing childhood trauma. And you can see the measures I used on the slide. The childhood trauma questionnaire, which breaks down into 5 subtypes of child maltreatment: physical abuse, physical neglect, sexual abuse, and emotional neglect. The International Trauma Questionnaire, which has 2 subscales. One measures simple PTSD symptoms and one measures complex PTSD symptoms. And the internalized shame scale for internalized shame, and the reading the mind and the eyes test for facial emotion recognition. To briefly discuss the sample, there were 166 participants. They were overwhelmingly white, 90.4% white, which I suspect reflects generally the demographics of the users of Reddit. And interestingly, about half were queer. And then about a third had ever used psychedelics with therapeutic intent, 31.3%. Over 90% of the samples scored in the severe range on at least one of the CTQ subscales. So this sample reported very high levels of developmental trauma. And those who had or had not ever used psychedelics with therapeutic intent reported comparable amounts of developmental trauma history. So now to move on to the results. Our first hypothesis was partially confirmed. So as expected, developmental trauma significantly correlated with internalized shame, with simple PTSD symptoms, and with complex PTSD symptoms. And this is all clinically intuitive, right? That more trauma exposure would be associated with worse outcomes, like more shame and more symptoms. But part C of hypothesis 1 was not confirmed. So childhood trauma was not associated with facial emotion recognition accuracy. And actually pretty much the entire sample performed more or less the same on the test. So regardless of trauma history, and also regardless of whether they had or whether they had any history of intentional therapeutic psychedelic use, pretty much everyone performed the same on the RMED. And then our second hypothesis was also partially confirmed. So using psychedelics with therapeutic intent was associated with significantly lower levels of internalized shame and complex PTSD symptoms, though not simple PTSD symptoms. And then these effects were strongest among the participants who had used psychedelics with therapeutic intent more than 5 times. So that's what you see here in these figures. These are showing people who have a history of more than 5 occasions of intentional therapeutic psychedelic use versus people who either have no history of using psychedelics with therapeutic intent, or people who have less than 5 occasions of such history. And then post hoc analyses showed that of all the developmental trauma subtypes, emotional abuse and neglect showed the strongest associations with both internalized shame and complex PTSD symptoms. So I ran moderation analyses and found that using psychedelics with therapeutic intent more than 5 times, so here on the slide called ITPU 5, significantly moderated the relationship between emotional abuse and neglect and complex PTSD symptoms or disturbances in self-organization. So that among all the participants who hadn't used psychedelics therapeutically more than 5 times, the blue line, there was a moderately strong positive correlation between emotional abuse and neglect and complex PTSD symptoms. But among the participants who had used psychedelics therapeutically more than 5 times, the red line, there was no significant relationship at all. This is a non-significantly negative relationship, actually, which in layman's terms means that amount of exposure in childhood to emotional abuse and neglect showed no association at all with the amount of complex PTSD symptoms in adulthood, which to me is quite striking. So before getting into Q&A, there are a few points I want to highlight regarding the implications of these findings. So first, this study shows that naturalistic psychedelic use, and not just like psychedelic therapy per se in clinical settings, when done deliberately with therapeutic intentions, may lead to therapeutic outcomes, including positive changes in self-concept and reductions of complex PTSD symptoms. A second important implication is that classic psychedelics like psilocybin, LSD, and ayahuasca or yahe, and not just MDMA, which has been the drug of choice so far in clinical trials of psychedelic therapy for PTSD. Classic psychedelics may show potential in the clinical treatment of complex PTSD, especially when it's associated with child maltreatment. And finally, I want to come back to this moderation finding, and I want to keep it in mind as I try to integrate and wrap up what I consider the most important theoretical and clinical implications of this finding, and then also link back to the theoretical model I outlined at the start of this presentation. So first, remember that using psychedelics with therapeutic intent was associated with lower complex PTSD symptoms, but not simple or classic PTSD symptoms. So what's the difference in terms of etiology and symptomatology between simple PTSD and complex PTSD? Simple PTSD is more frequently associated with a single or a small number of isolated traumatic events experienced in adulthood. And the hallmark symptoms include re-experiencing and intrusion of traumatic memories and avoidance of reminders of the trauma. Complex PTSD, on the other hand, is associated with chronic experiences of trauma over a prolonged period of time, most often during development in childhood. And the complex PTSD symptom cluster in the measure I used is named disturbances in self-organization. And as that name suggests, the symptoms that constitute complex PTSD centrally relate to the self. Now, also remember that of all the types of developmental trauma, emotional abuse and neglect were most strongly associated with complex PTSD symptoms. which suggests that the pervasive and disturbed relational patterns of caregiving that mark emotional abuse and neglect have a lasting negative impact on the developmental process of forming or becoming a self. And so psychedelics, which can often catalyze experiences of a total loss of self and then a subsequent reforming of the self, might be particularly well suited as therapeutic agents in disorders involving disturbances of the self, most notably complex PTSD. And here are a few quotations from participants in the study that may illustrate this process of coming to embody a more adaptive self-schema that psychedelics can catalyze. One person said, "It showed me who I am and that I like myself." Another said, "Psychedelics made me feel real for the first time in probably a decade." Another one, "That trip was a gut wound to my ego and the best thing to move towards a healing and authentic life." Someone else said, "I was exactly who I was supposed to be." And my favorite of what anyone reported, "It has freed me from the ego that I've spent my whole life creating." So in sum, being traumatized by our caregivers as babies and children critically imprints the development and organization of the self, how we experience and express emotions, how we relate to other people, and how we think of ourselves. Using psychedelics with the intention of healing the wounds of our childhoods may enable us to positively reshape a self that's stuck in the pain of the past and embody a self more fully grounded in the present. And before we get into Q&A, I'm excited to tell y'all that this study is about to be published in Chronic Stress and should be online in the next few weeks. Thanks very much, y'all. I look forward to any questions.
Thank you so much, CJ. Another very important topic, and I'm really glad to have heard your presentation, especially the last quote that you used was really powerful. So thank you so much for it. And yeah, we have a few minutes for some questions. Yeah, there is one submitted by Eva, which says, "Hello, cool study. I did my thesis on early maladaptive schemas as a precursor to major depressive disorder in adolescence. If we are understanding early childhood trauma from a cognitive schema model, do you think that participants who use psychedelics therapeutically in a schema therapy model of Young, Klosko, and Bashar could benefit more as opposed to using it in a naturalistic setting with only therapeutic intention? Do you see any potential for integrating schema therapy with psychedelic assisted psychotherapy?"
Yeah, I love this question. I'm only vaguely familiar with schema therapy, but from what I know about it, it's kind of like a therapy that's kind of integrating cognitive therapy with psychodynamic principles and I think attachment theory as well. But yeah, I mean, my sort of career goal is to be a psychedelic therapist, working within a psychoanalytic orientation, and I do think that the way that psychoanalytic therapies, I think including schema therapy, really place the emphasis on what not just understanding and like Dr. Vollenweider said, working through experiences from the past, but then also paying attention to what's happening in real time between the patient and the therapist. And I think that the psychologically and neurologically plastic state that psychedelics provoke can basically, in a nutshell, can allow for the relational experience that's happening between patient and therapist to re-imprint those maladaptive relational schemas that were developed in childhood. So I guess to answer the question more directly, yes, I do think that the interpersonal nature of therapy, I think, allows for a more robust healing effect than doing it, for example, on your own. But that said, this study still does show that using psychedelics in naturalistic settings, which might include, doing it with close friends, with doing it with loved ones, that these experiences too can have really lasting benefit.
Great, thank you so much. If there are more questions, you guys are welcome to still text CJ in our chat, and I hope you stick around a few more minutes to answer some of those in case. Thank you so much again.